I'm Amina and I'm 18 years old. My father is the chief in the village and my mother is an important woman. My brother and sister are younger than I am, but we all used to study, play and work together. That was before all the trouble started.
1 in 3 women globally have been subjected to physical or sexual violence in their lifetime. For migrant communities, that figure can be as high as 1 in 2. Getting these women the care they need is a critical part of the migrant response in Bangladesh. Alongside the Sexual and Reproductive Health Working Group and GBV subsector, WHO conducts training workshops to ensure quality clinical management of rape and intimate partner violence services during the Rohingya crisis.
I'm called Samrarita Safa. I work as the gender-based violence in emergency specialist in Cox's Bazar. The WHO acknowledged that health services for GBV survivors are very vital, are very life-saving. By building the capacity of doctors, midwives in the area of CMR and intimate partner violence, we make sure that they treat survivors of GBV the right way. It's only not about knowing the technicalities, it also has to do about the feelings.
Today's compassionate referral training puts participants in the shoes of a survivor of gender-based violence. In following their stories, health workers will encounter the same difficult choices and no-win scenarios. Facing these difficult decisions give participants a better understanding of what it means to be a survivor.
Hi, this is Mohammad Ashrafur Rahman. I work as a GBV program analyst with UNFPA here in Cox's Bazar. My character here is Naima. She is a 28-year-old woman, a single mother. Her husband left her. She has 2 kids, twins, and she is kind of like managing by herself to feed her children. She became a sex worker eventually, and after working for a few days, she developed sexually transmitted disease. I mean, I really put myself in Naima's shoes. That person could choose this path because she literally has no other choice to go, right? So from that angle, I feel like definitely nobody should judge anybody without knowing her story.
This training gives health workers an opportunity to reflect on barriers to quality care. A more compassionate referral service means survivors are more likely to get the support they need.
At the end of each story, they were posed with options. It could be 2 options, it could be 3 options. And as they were choosing, many of them were very irritated because the options were very limited. The options were also not the best options. I have seen participants and they were mentioning that they were really angry. Some of them also wanted to cry because they felt like this is what it means to be a survivor.
If I am Amina, so maybe I feel that it's very hopeless for me, helpless for me. I mean, I will totally destroy myself.
Why the hell you are doing this? Why you are doing this to a woman? Like, she's a child.
We had today is Betty's character, who really loves very much to go to school with her another friend, Fauzia. They had lots of hopes, but yes, unfortunately, when Betty's parent and both Fauzia's parent decided to marry them off. We know that being GBV or case management actors, we have to have empathy on the survivor, but based on these stories, it gave me actually another chance to think, give the survivor a space, a safe space, where a survivor can, share all the situation she went through and seek support.
Compassionate referral is just one of a package of trainings provided by WHO to cater to gender-related health challenges in Bangladesh.
One of the biggest components that we do is provide trainings or capacity building on clinical management of rape and intimate partner of violence. In addition to this, there are other components as well where we do quality assurance to make sure that there is available service, but also to make sure that the services that we provide are also of quality.
At the end of each session, participants are asked to discuss their experiences.
So at the end, when we debrief, and it's very important that we also focus on how they feel.
And also maybe reflect a little bit. Can we make it a little bit easier? What can we improve in the services that we provide?
An individual can be very unlucky actually if she or he is not supported well by the family in the first place. I mean, because in Betty's story, I mean, where she had lots of hopes, dreams, and a good friend, but everything got, destroyed because of the decision made by the parents.
Being a man, probably it's not possible at all to understand how a woman goes through when she is as a survivor of gender-based violence. But maybe this is one of the ways to go through those stories, put ourselves on their shoes.
I'm the health service provider person, but I also see that maybe one day we need to care like 30 or more than 35 people to giving the service. But we need to think every single person, how difficult they are going through and how significantly they are seeking their help from us.
Violence does not happen to only one sect of a community. It happens to any woman from any background. She can be rich, she can be poor. It can happen to anyone and everyone.
Be empathetic.
Being non-judgmental is a key. Everybody has a role to play.
Every service provider need to come in one umbrella.
I think we need to be honest and we don't need to make any false promises to our survivor. So being polite and being honest is most helpful for them.
Get yourself educated as much as possible.
Survivor knows best for herself what is good or what is bad for her.
Treat all individuals with respect and dignity.